So hello everybody and welcome to this APPG on the National Food Strategy, and today we're looking at dietary inequalities and food insecurity, and I'm delighted that the meeting will be opened by Lord Krebs, who the Lord Select Committee produced an amazing report, which I must say sort of triggered my interest in the whole breadth of this issue around food poverty, health and environment. So levels of poor and undernutrition and associated health outcomes are not evenly distributed through the population. Today we're going to explore why this is and what drives these differences and what we may be able to do to narrow the gaps. A crucial piece of the puzzle is lack of income. In our last APG session on obesity, for instance, we heard from Professor Martin White that healthier foods are often 3 times as expensive on average per calorie than less healthy foods. And that makes having a healthy diet much more difficult to access for those on a lower income. We also heard that the food environment in lower income neighbourhoods tends to be less supportive of a healthy diet. Fast food restaurants are more concentrated in low-income neighbourhoods, and I know that for a fact. So I'm the MP for Stoke-on-Trent Central, and it clearly is the case there. And retail outlets selling a wide variety of healthy foods tend to be far less common. And I know that several officers of this APPG are particularly interested in these issues. Ian Byrne, who's not able to be with us today, is a vocal advocate for incorporation of a right to food in law. Sharon Hodgson is chair of the APPG on school food and was involved alongside Kerry McCarthy, another of these APPG's officers, in the Children's Right to the Food Commission, a youth-led inquiry into child food poverty.
During this lockdown pandemic, we've all seen much higher profile food inequality than we ever saw before. It was a serious issue before, but it's become even more acute during the pandemic.
The exam question I've been set is, what should the National Food Strategy recommend to tackle dietary inequalities? There are massive health inequalities in this country. Life expectancy difference between the wealthiest and the poorest people is 9.5 years for men, 7.7 years for women. Perhaps even more striking is healthy life expectancy difference, which is nearly 20 years between the richest and the poorest in this country. Dietary inequality is one of the important factors contributing to these health inequalities. So in our report, we included as food insecurity both going hungry, skipping meals, and inability to acquire a healthy diet as defined by the Eat Well plate. These are 2 distinct manifestations of food poverty or food insecurity. Food poverty is, as you all know, not a separate phenomenon, it's a consequence of poverty. Between 1/5 and 1/4 of children in this country, one of the richest countries in the world, live in poverty. Many of them will suffer from food poverty or food insecurity. So what lies behind that? In our evidence, we heard a very substantial causal factor is to do with universal credit. Both the delay in payment, the 5-week delay to receive payment of universal credit, and the fact that benefits often don't allow people to afford a healthy diet. DWP was quite clear that benefit payments, in calculating, the government calculates how much money should we give people, they don't conclude a consideration of what it costs to eat a healthy diet. Money is not the only barrier to accessing a healthy diet. And others that we heard about include emotional bandwidth, accessibility, and time. And we kind of illustrated this by what we call the healthy soup fallacy, because some people say, well, actually, you can eat healthily on a very low income, for example, make a healthy vegetable soup. And we go through why that's not a plausible option for many of the poorest people in this country. It takes time, it takes knowledge, it takes equipment, it takes access to the ingredients, and that may not always be straightforward. The cheapness disguises the fact that for those of us in the middle classes, we have hidden store cupboard ingredients. And then at the end of it all, having made this healthy vegetable soup, if you overcame all the hurdles, it's quite possible that your family wouldn't accept it. So it's not simply a straightforward message of re-educating people to eat cheaply. There are much bigger problems. What we identified in every area we looked was delay and failure to act. So there's a narrative here about consultation rather than action. I'm running out of time, so I'm just going to say a couple of words about governance. The key problem is that responsibility for the issues that we're talking about fall across many government departments. None of those departments has healthy dietary health and inequality as its top priority. There has to be some appropriate governance mechanism. And we suggested two things. First, a high-level ministerial group chaired by a member of the cabinet to make sure departments coordinate. Then there's reporting and monitoring, which is crucial, so hold the government to account. And I think, given that the government won't accept a CCC-like body, that should be given to as a new responsibility to the Food Standards Agency. Why the Food Standards Agency? It's the only department of central government that has entirely as its focus food. It has more sustainability and clout than a non-departmental public body, and it's fully independent.
Have you had any further conversations about that concept, either with government or with the FSA?
I haven't with government. I did have a conversation with Henry about it, and Henry was toying with it as a possibility.
Are there any questions?
We need to put home economics back into schools desperately and get it going quickly again.
What we used to call domestic science in schools and working with food and cooking is really important in my view.
We are teaching food preparation and nutrition in school, and it is compulsory up to the age of 14 to happen, but people aren't aware of it. We had the taking away of the A-level in food. It would be lovely to see that A-level reinstated.
Yeah, my name's Jeff Fimister. I'm, among other things, a researcher for Baroness Lister, who sends her apologies. You made the point that the government was resistant to the idea of factoring into the benefit rates and elements to represent adequate food. A lot of us would argue that what we need is for the government to commission research on minimum income standards to inform the development of benefit rates, and food would be part of that picture.
My question really is about food banks. The problem is that they're becoming almost institutionalized. Food shouldn't be cheap or free. It should be affordable. People should be able to afford good, healthy food in their local communities.
The country should not depend on food banks to allow people to eat. The question is, why is a healthy diet not affordable? It is actually the case that food in this country is pretty cheap. I mean, cheaper probably than it's been before. So it's not really about the priciness of food. It's about the inadequacy of benefits. Let's ensure that people have enough income, whether it's through a job or benefits or a combination, to be able to afford the diet that would give them a healthy body and a healthy life expectancy.
We have Dr. Maria Bryant, who's a reader in public health nutrition at the University of York. We have Deidre Woods, who's the visiting research associate at Coventry University, and Simon Shaw, who's the head of food poverty program for Sustain.
There are certain vulnerabilities that make you more or less likely to be food insecure. And being a family with children is one of those. And in fact, the younger the child, the more likely you are to have a food insecurity. In 2017, 10% of children in the UK were living in households that were affected by severe food insecurity, which of course indicates hunger. There are multiple studies showing the physical and behavioural impacts of this. Children living in families with food insecurity are more likely to be overweight or live with obesity, more likely to consume added sugars. They're less likely to eat breakfast, and they are also less likely to have dinner with their families. And of course, we all know that COVID has exacerbated this. I direct the food and obesity research in Bradford. Overall, pre-COVID, our families, we had 14% prevalence of food insecurity. That has now gone up to 20%. We worked again with the Food Foundation, asking children what their three biggest worries were. And unsurprisingly, they talked a lot about losing family members as a key concern for theirs, and issues with school. But what surprised us probably more was the number of children that focused on financial problems and food.
Black people from Islington, Lambeth and Wandsworth, who make up 16.8% of the local population, were made up 39.6% of food bank usage. And it's estimated that Black and ethnic minorities in the UK are 1.5 times at risk of food insecurity in comparison to white British people. So I know we've touched on sort of poverty being a major factor, and for Black and Asian women in particular, there are high levels of household food insecurity. These are down to a variety of issues. Generally, these foods, especially the imported foods that are culturally acceptable, are unaffordable. There's often irregular and insufficient supply of items. Part of the right to food is about access to culturally acceptable food. There are no marketing standards for most African and Caribbean foods. Processed products are adulterated. A lot of seasonings and other products marketed at sort of Black and African communities contain high levels of salt, additives, sugar, and unhealthy fats like trans fats. There are barriers to the small percentage of farmers and growers from these backgrounds and of people wanting to enter farming or market gardening to produce culturally acceptable foods that we can grow here or produce here to scale. And those include access to land, training, startup costs, racism in rural Britain.
Malnutrition, food insecurity amongst older people can be linked to income, but it can also be linked to disability, health conditions, isolation, and poor access to nutritious food, as well as a lack of social care support and other kinds of support. So sadly, an estimated 1.3 million older people in the UK are malnourished, and there has been some welcome advances on the quality and of food in hospital, which disproportionately impacts older people, but there is currently a lack of action around access to food in the community. Often when you say Meals on Wheels or lunch clubs, people are perhaps thinking back to 20, 30 years ago. But there are so many examples of modern, contemporary, dignified approaches to meals delivery, shopping support, lunch clubs. So in terms of what a new national food strategy could recommend, we certainly need a much more robust and supportive policy framework to support older people's access to food. We do all need to have a common understanding and appreciation of the cost-benefit analysis of supporting older people's access to food. It can prevent hospital admissions, readmissions, and greatly increase quality of life. The National Food Strategy could call on government to support provision across communities, but we need the funding that comes with that to make sure healthcare and community settings can genuinely work together, so that if social care is supporting food provision for older people, they do see some budgetary benefit, and it's not just the health service that is benefiting from that.
Bob Doherty has asked, why is the government resistant to take action given the huge costs of dietary ill health for the NHS?
Many people in government would take the view that what we choose to eat is a matter of personal choice and lifestyle, and therefore the government has no role in trying to intervene in that. But actually, for many people in this country, they don't actually have much choice because they're, constraints of budget, of time, of knowledge, and so on. So I think that's one point. I think there's another point about the trade-off between too many restrictions on say promotion and advertising, and the pressure from various components of the food industry to maintain their profitability. So I think the government quite rightly weighs up impacts on health and impacts on industry, employment, jobs, and the economy. But I think it's a complicated area. I personally think they should do more, as I made quite clear.
Simon, I had the privilege of going to a school a number of years ago where they were providing meals. They were encouraging older people to come into school, to eat the school food, which they were enjoying. It was fantastic.
It certainly seems to me that school kitchens and other similar kitchens in the community are underused. School kitchens are such a community asset. They really need to be maximised.
In our inquiry, we had a roundtable discussion of right to food, at which Sustain and others made very good presentations. In the end, we chose not to put it in as a recommendation. We thought there were arguments for and against, but we weren't convinced. But I mean, I remain open-minded about it, but certainly at the time of our report, we thought if you wanted to address the problems with the food system, which we talked about earlier, are many and varied, let's get on with that rather than introducing a new complication with legislation about a right to food. Let's actually address the substance of what's wrong with our food system. That was our view.
It's very easy to identify the problems. Identifying the solutions is always a much bigger challenge. But we've had potential examples of solutions during the conversations we've had. So let's hope we can persuade government, or the National Food Strategy can persuade government, to actually adopt some of these issues.